Welcome to the Greenbridge Minute, brought to you by Greenbridge Health and Greenbridge Society. My name is Dr. Gerald Knepp. I've worked directly with thousands of cannabis patients, and many of them have successfully used cannabis in treating cancer, cancer-related symptoms, and mitigating adverse effects of conventional treatments. Using cannabis products to treat cancer-related symptoms and mitigate adverse effects has significant scientific support. Cannabis has demonstrated the ability to reduce chemotherapy-induced nausea and vomiting. In 1985, the FDA approved dronabinol, which is just a synthetic THC, for treating nausea and vomiting associated with chemotherapy. Cannabis has demonstrated the ability to help with other symptoms associated with cancer and cancer treatments, like insomnia, anorexia, anxiety, and chronic pain. Please see our other videos and resource pages for more information on using cannabis for those symptoms. Before moving on to how cannabis fights cancer, I'd like to highlight a group of cancer-related pain studies. The original study looked at using cannabis extracts in patients with intractable cancer-related pain that was not relieved by strong opiates. Both the THC-only extract and the THC-CBD combination extract were significantly better than the placebo, with the extract with both THC and CBD having the best results. A follow-up study with these patients concluded that long-term use of THC-CBD combination was generally well tolerated, with no loss of effect for relieving cancer-related pain. Furthermore, patients who kept using the medication did not seek to increase their dose of cannabis. There are more than 200 types of cancer, and they often require different treatments. At Greenbridge, we have seen many patients with different types of cancer receive benefits from cannabis, and we have heard testimonials from many more patients on how cannabis has helped in their battles with cancer. Most of the scientific evidence supporting the use of cannabis to treat cancer is considered preclinical, meaning that it has occurred in lab cultures or animals. Cannabis products can contain many different biologically active compounds, and the overall effect of those chemicals is referred to as the entourage effect. Most of the preclinical research has studied individual chemicals from cannabis. One group is the cannabinoids. Several cannabinoids have demonstrated an array of anti-tumor and anti-cancer effects. Delta-9 tetrahydrocannabinol, or THC, is one of the most well-known cannabinoids and is associated with the psychoactive effects of cannabis. Some studies have suggested that THC might have potential anti-tumor effects by inhibiting cancer cell growth, inducing apoptosis or programmed cell death, and interfering with tumor angiogenesis, or the formation of new blood vessels that supply tumors. Cannabidiol, or CBD, is the second most abundant cannabinoid, and it has become popular over the past 10 years. Research has shown that CBD may exhibit anti-tumor effects by inhibiting cancer cell growth, inducing apoptosis, and modulating various signaling pathways involved in cancer progression. CBD has been investigated for its potential to inhibit the growth of various cancer types, including breast cancer, lung cancer, and glioblastoma. Other cannabinoids such as CBG, CBC, and CBDA have demonstrated potential anti-cancer and anti-tumor effects as well. Terpenes are another group of chemicals found in cannabis. Terpenes give cannabis its flavor and aroma. Some terpenes provide medical benefits, and several have been studied for their anti-cancer effects. Beta-caryophyllene is a terpene found in many plants, including cannabis. It has been investigated for its potential anti-inflammatory and anti-cancer properties. Some studies have suggested that beta-caryophyllene might have anti-cancer effects by inhibiting the growth of cancer cells and inducing apoptosis. It also interacts with the CB2 receptor, potentially contributing to its effects. Limonene is a terpene known for its citrus scent. It has been studied for its potential anti-cancer effects. Limonene might inhibit tumor growth, promote apoptosis, and have anti-inflammatory properties. It has been explored for its potential role in breast cancer and other cancer types. Pinene is a terpene found in various plants, including pine trees and cannabis. It has been investigated for its potential anti-inflammatory and anti-cancer effects. Some research suggests that pinene might inhibit the growth of cancer cells and modulate certain signaling pathways. However, its anti-cancer effects are not as extensively studied as other terpenes. Humulene is a terpene found in hops and cannabis. It has shown potential anti-inflammatory and anti-cancer properties in some studies. Research has suggested that humulene might inhibit tumor growth, suppress inflammation, and have potential immunomodulatory effects. A third group of chemicals, the flavonoids, are a diverse group of natural compounds found in various plants, including cannabis. These compounds are known for their antioxidant, anti-inflammatory, and potential health-promoting properties. Canflavin B is one of the flavonoids found in cannabis. In a 2019 study, canflavin B demonstrated significant anti-cancer effects against pancreatic cancer cell lines in the lab and increased the survival of animals in preclinical studies. In May of 2023, Flavicure Biotech received clearance from the FDA to begin phase 1 clinical trials of their drug, caflenone, which is based on canflavin B for the treatment of pancreatic cancer. Medical cannabis definitely has a role to play in treating cancer-related symptoms and mitigating some of the adverse effects of conventional cancer treatments. More research is needed to fully study the effects of medical cannabis on different types of cancer. The combination of anecdotal and preclinical evidence makes a strong case for fully funding clinical research for using cannabis to treat cancer. We encourage cannabis patients to work with an experienced medical professional. At Greenbridge Health, we work with the patients one-on-one to find the best cannabis products and treatment plans. If you would like to learn more or schedule a medical cannabis consultation, please go to our website, greenbridgehealth.com, and make an appointment to meet with one of our experienced medical professionals. We look forward to helping guide you on your cannabis journey back to health.